Welcome, my fellow veterinary colleagues and those working in the animal care world. I am Dr. Erin Holder, creator of Veterinary Compassion Project, cultivating resilience within the profession. While the veterinary field is rewarding, it is profoundly exhausting and over time takes its toll on our mental, emotional, and physical health. These blogs are my experiences of owning a large integrative hospital for 18 years and learning from my many mistakes. Understanding where I went wrong and how I crashed and burned has been a journey to healing myself and hopefully others. Here is my latest blog. My somatic healing experience. On my journey to healing and helping others heal in the veterinary profession, I have decided to attend as many healing modalities as possible to experience each one firsthand. What I know positively from my journey is that in order to move forward, we have to look backwards. It is undeniable that unresolved traumas block much of our growth and expansion. It is also undeniable that we get stuck in our behavior patterns that originated from our childhood experiences. My somatic healing guide did an exceptional job of explaining how we perceive certain data in our youth, and this cements our behavioral responses that at the time were appropriate, however, later in life are inappropriate or potentially harmful. Ever think this always happens to me? Or meet someone that you see making the same choices again and again despite the less than satisfactory outcome? That is being stuck. So how do we get unstuck? Historically, much of our behavior and trauma work has been through talk therapy. While I think talk therapy is beautiful and profound aha moments can occur, often talk therapy creates a space in which patients have to relive the traumas. It also can take quite a bit of time to get to a healing place of even just one trauma. In the late 1980s, Dr. Francine Shapiro discovered rapid eye movement and its ability to more quickly heal PTSD. Her first clinical trial of EMDR, eye movement desensitization for reprocessing, was in 1989. Dr. Shapiro's discovery fueled the flames for looking outside of talk therapy to heal patients, and in so doing, reignited modalities of healing from the past. One of those healing modalities is somatic healing. While it was practiced and first written about in the early 1900s, it did not gain popularity in the U.S. until recently. Dr. Amanda Baker explains somatic therapy as a treatment focusing on the body and how emotions appear within the body. Harvard Health goes on to explain that because unsettling emotions often manifest in the body in disabling ways, somatic therapy seeks to neutralize their impact, alleviating pain and other stress-related symptoms like sleep disturbances or difficulty concentrating. But I did not fully understand this before my session. I decided not to do any research on somatic healing and go in with no expectations or even basic knowledge of the modality. So before our session, my guide explained a bit about it. Somatic healing is a way of connecting to self while retaining the ability to stay connected to outside of self, whether that is a person or environment or both. I listened to his introduction about how our bodies hold certain experiences and that can dictate behaviors in life. I understood that somatic healing was about creating that mind-body connection and keeping it throughout the day, to consciously breathe, consciously walk, or do whatever we are doing, but doing it consciously. If we stay in our body with presence, we are less likely to sleepwalk through life. We live our life and make decisions from a place of awareness. If you live a life with awareness, you are far less likely to live a life of reactivity. And lastly, living a life of awareness is the only way in which we can assess our behaviors and make changes for our health and well-being. I listened intently to what he was explaining and decided to let the knowledge go while I experienced the healing session. I tend to stay in my head analyzing and picking things apart, but that day I set it aside and hopped up on the table. Somatic healing was very different from what I anticipated. Comparing it to massage therapy briefly, the masseuse is working only at the physical level of the body. Hands-on working the muscles, tendons, ligaments, etc. There's no attempt to work on any other plane, such as emotional or spiritual. During a massage, it is quite okay to drift off to sleep. But in somatic healing, there's an interaction during the entire session. I was instructed how to breathe and what part of the body to breathe into. I was asked to compare the side that had been worked on to the side that had not. At the end of the session, he asked me how I felt. Not even thinking of the earlier conversation, I said to him, I felt like I was floating away, but then you would tell me to breathe and it brought me right back. You didn't allow me to really float away. You kept me tethered. And that was entirely the point. Connect to outside of self while remaining connected to self. I was expanding yet staying grounded. He placed pressure in certain areas of my body while I consciously exhaled to release. Maybe the release was on a physical plane, so I released muscle tension, but maybe there was an emotional component that was stored. I could see that this work would help release it, help to get us unstuck. One of the things I was most struck by was how safe I felt in the environment. This is particularly critical when working with healing, so make sure you begin your healing journey to trust your intuition. Work only with a healer that makes you feel safe and secure. There is so much chronic illness in the U.S. that cannot be explained and justified with physical ailments and symptoms alone. There is undoubtedly a connection of the emotions with the physical body, a mind-body connection. We cannot rely on pharmaceuticals to heal our bodies if we are unable to heal our minds. We cannot expect any drug to miraculously cure our emotional health. And if our emotional health is ill, how can our physical body return to an optimal state? If pharmaceuticals truly worked at this level, we would have almost no chronic illness. Instead, we see a crisis of chronic disease and a complete failure of modern medicine to cure it. So we are faced with two paths and one choice. We can stay on the path in which we do not grow or expand. We accept our behaviors as us, and we continue to rely solely on pharmaceuticals for healing. Or we can choose the path of healing. On this path, with every step, we feel the earth, smell the flowers, hear the birds, and we see ahead. We meet ourselves and learn who we are and what experiences shaped us. We learn to forgive ourselves, and we learn to embody grace. Of the two paths, the latter is clearly the more difficult, for we find comfort in the knowing. We know what to expect when we stay on our same path. We even know what fights we'll have. We have a false sense of security in that knowing. Maybe you even choose to stay on that path because you feel it's right for your family. It's the best thing to do, the selfless thing. But once again, this is your mind trying to keep you in that false sense of safety. It is when we make the transformative decision to choose the more difficult path that we must be prepared for the hard work ahead. We are looking back at our lives and assessing the foundation. We stop with our reactivity and move consciously. We let go of behaviors that do not serve us any further, possibly even addictions that hold us back. We are brave enough to ask for help, and we are strong enough to let go of whatever we are holding on to that makes us feel stuck. In so doing, we create a joy and peace that is a must in the veterinary profession, and we create many new and exciting pathways for life. Follow me on Spotify, Facebook, Instagram, YouTube, and my website at Veterinary Compassion Project. Let's keep talking about what we face in the veterinary and animal care world and ways that we can help each other. Register now for our live event in Northern California, April 4th through 6th, 2025. We can and must build resilience within the veterinary profession. As always, I hope you find what you're looking for and share it with anyone who needs it. With love and hope, Dr. Erin Holder.